We are currently serving approximately 32 to 35% of the jail census is receiving some type of mental health service while they're incarcerated. Unfortunately, we have seen is that when they don't receive mental health services while they're incarcerated, their length of stay tends to be longer.
I think as a nation, unfortunately, we failed to provide the community treatment that we said we were going to do 40, 50 years ago. And so we deal, unfortunately, with a mentally ill population, a significant portion that does not have access to doctors, to treatment, to medication, and our jails have to deal with it. And that is not the place that, as a society, that we want to deal with mental illness. It's not. Definitely we provided in the past a level of service that we were required to provide by the state, but it was a minimum level. And when I would go into the jails, and I do quite frequently, and walk through the housing areas, I would notice a lot of times, especially people suffering from mental illness, would just be locked away in a cell, and we would just kind of try to maintain their status quo for as long as they were with us. And it was not a pleasant thing. A lot of these individuals would refuse to take medication, would decompensate, would become violent, would smear bodily fluids on the walls, and then the jail employees would have to respond to that. And sometimes, unfortunately, would have to use force to get control of people and all the problems that result from that. And so we definitely saw a need to make improvements for many different reasons.
Trying to see where we can reduce recidivism, because a lot of individuals may be off their medications or having a crisis, and they end up going into the criminal justice system rather into the mental health system. So it's critical that we're able to try to help them, if they do end up in jail, not to go back. I look at this as a benefit to the community from a public safety perspective. Somebody broke the law. That's why they are arrested and they went into the jail. If we're able to identify the mental health issues, that may have been the root cause of why they broke the law. Not always, but it could be. And so if we're able to identify those issues and then attempt to link them to some services in the community, the likelihood of them reoffending is decreased.
What we envisioned with this partnership with Emergence Healthcare was identifying at the front end individuals who are suffering from mental illness. Those, unfortunately, that end up in the jail, that do have to face their charges, that are dealing with mental illness. If we can provide treatment in the jail, and when they get out, ensure that there's some, again, continuity of care. That's a term I think that gets overused, but it's important. Then potentially that person will not reoffend and will not end up back in jail. And again, it saves money, but more importantly, it prevents crime. It prevents people from getting hurt, prevents people from getting killed, and ultimately that's a benefit for our community.
The local mental health authority in Austin has a very successful partnership with their county sheriff's department and their jails. And we were able to look at that model. We're not exactly the same because obviously El Paso's not Austin, but we're able to look at the ideas and what they're doing, and actually some of their staff help train our staff, and they also have given us kind of the do's and don'ts, the lessons learned, to where we were able to avoid some of the mistakes they made. We also looked at the Houston County Jail, and for those who don't know, the Houston County Jail is the largest mental health provider in the state of Texas. And so that's unfortunate. And so they also have a very good partnership with their local mental health authority in order to provide the service and also create the continuum.
It's going to take some time, but we're willing to put in that commitment to continue to move forward and to make improvements that have really been needed for years and years in this community.
We are seeing around 900 inmates a month just in mental health. And so I want to make sure that we're able to meet those needs. And so just continuing to provide the outcomes that the county wanted to see, the reduction in the recidivism, providing that public safety aspect, we can grow in staff and be able to do more for more inmates.